Thank you everyone for attending the St. Luke's Sustainability Program and the Idaho Clinicians for Climate and Health Lecture Series. Today we have two speakers from the Office of Climate Change and Health Equity within the Department of Health and Human Services, here to talk about the HHS Decarbonization Pledge, answer questions, and provide background about what's going on with the HHS and the Office of Climate Change and Health Equity. First up, I'm going to introduce Jenny Keroack. Jenny is a senior policy advisor with the Office of Climate Change and Health Equity. Previously, she worked as a health insurance specialist with Center for Medicare and Medicaid Services in the Office of Legislation. She is a Fulbright research grantee for Romania and senior analyst at the National Journal Network Science Initiative. Jenny will be speaking today, as will Joe McCannon. Joe works at the U.S. Department of Health and Human Services as a senior advisor in the Agency for Healthcare Research and Quality. He contributes to standing up to the department's Office of Climate Change and Health Equity, which we call OCHE, and manages the office's work to mobilize and support the healthcare sector. He served in the Obama administration as senior advisor to the administrator for CMS and was part of the founding team at the Center for Medicare and Medicaid Innovation. He previously was vice president at the Institute for Healthcare Improvement and co-founder of the Billions Institute. He has taught graduate level courses on large-scale change and quality improvement at UPenn School of Social Policy and Practice and the Harvard T.H. Chan School of Public Health. His writing has appeared in JAMA, the New England Journal of Medicine, Health Affairs, and Harvard Business Review. He's a graduate of Harvard University and was a Reuters Fellow at Stanford University. So please welcome Jenny Keroack and Joe McCannon from the Office of Climate Change and Health Equity.
Great, and I'll just share my screen here, Joe.
Great. Well, thank you very much. We really appreciate the opportunity to be here with you today, and are looking forward to sharing some of the opportunities created by this administration with respect to climate and health, and to hearing your questions and your reactions. I think these sessions for us are always enjoyable to the degree that we understand more about your challenges and the specific areas where we can best support you. So we'll try to move at a pretty healthy clip so that we have adequate time for that conversation and that exchange. But before we get there, and before we get into the Inflation Reduction Act in particular, which is really kind of the centerpiece of what we want to describe to you here today, I do just want to set the scene a little bit and say a little bit more about why we're here. And I would say, why we're here having this conversation today, but why specifically we're here as an Office of Climate Change and Health Equity. And if we go to the next slide, the answer really is rooted in a combination of factors, starting with the catastrophic climate-related events that we've experienced this summer season and in a number of prior seasons, from intensifying storms to wildfire smoke to flooding and high-volume rainstorms to maybe above all extreme heat that carries with it high degrees of morbidity and mortality. There's a whole set of kind of catastrophic weather-related, climate-related challenges that we're facing. And then, of course, in addition to that, we have if we go to the next slide, we have a whole set of sequelae that are related to health writ large, all of the chronic conditions, for instance, that are exacerbated by climate change, the cardiovascular disease, the respiratory illness, not to mention increases in vector-borne disease and waterborne illness, not to mention mental health burdens and crises. There's a whole large constellation of chronic impacts and disease-related impacts in addition to these catastrophic weather events. So that sort of is one major thrust for our existence. If we go to the next slide, a second major reason we exist is because these climate-related disasters and threats carry with them significant threats to the regular and effective operation of the healthcare system itself. So all of these injuries and harms that we're experiencing in the general population that are related to climate change are only going to be that much worse if we don't have a health system that's able to address and meet those needs. This image just shows billion-dollar disaster events over the last 20 plus years. It doesn't kind of pull out impacts and costs for healthcare, but what we know is that healthcare systems are dealing with more challenges to keeping their doors open, again, related to these catastrophic events. They're experiencing disruptions in service. They're being forced into evacuations. And so these are all of the things that we also need to address in our office. The final reason we're here, and the reason we're not just the Office of Climate Change, but we're the Office of Climate Change and Health Equity, is because we know that these climate-related impacts that I'm describing, like most public health impacts we see in this country, are disproportionately experienced by certain populations for reasons of discrimination, underinvestment, disenfranchisement. There are certain parts of the country that are more exposed, less well prepared, more vulnerable. And so when these climate-related hazards occur, they're going to bear the brunt in a much more serious way, whether it's communities of color or indigenous communities or rural communities or disabled communities and more. All of these groups have specific exposures that we know and have observed lead to much more harm and suffering. And so that's all the backdrop against which our office, the Office of Climate Change and Health Equity, was created. It's not to say that the Department of Health and Human Services hasn't had meaningful investments and attention to climate change over the last 10 or 20 years. The CDC has a climate and health program that has made investments at a local and regional level on resilience. NIH has done research through the National Institute of Environmental Health Sciences on climate-related impacts. The Assistant Secretary for Preparedness and Response, which is responsible for the medical component of response to disaster events, the medical response, has itself dealt with that in the context of climate-related events. But what the Biden administration did in creating this office is it said there should be a single purpose-built entity within HHS to coordinate and catalyze the activity of all of the HHS agencies, not just CDC and NIH, but CMS and HRSA and the Administration for Children and Families and FDA and the whole suite of organizations that are responsible for managing the needs of the health needs of different populations in the country. They should all be engaged in this work. And they should all be engaged with an eye to those vulnerable communities that I described. We were set up in the office of the Assistant Secretary for Health, Admiral Rachel Levine, and set up with a pretty bold mandate in the summer of 2021. And effectively what the office is seeking to do over the next 5 years is to engage communities and healthcare organizations around the country in this work such that they're transformed, such that every community and care provider in every geography is prepared for both the disruptive and chronic impacts that I was describing, such that healthcare institutions can avoid disruptions of the kind that I was talking about and avoid associated harm, and such that hospitals and health systems in the country are themselves actively contributing to addressing climate change by looking at their own emissions. And we know that the healthcare sector is responsible for roughly 8 to 9% of emissions in the country, and we know that that's a very meaningful contribution, and that by tackling Scope 1 emissions, direct on-site emissions, Scope 2 emissions, emissions associated with purchased energy, and Scope 3 emissions, emissions associated with the value chain, that they can make significant strides in actually addressing their own emissions. So all of those things together are the things that we're trying to mobilize all of HHS to support the U.S. health sector on addressing. Now, the way that we've started this work ourselves at HHS is by, actually, Jenny, if we could just stay on that slide. The way we've started this work ourselves at HHS is by ourselves being very clear about our own aims and our own objectives. So we have gone out publicly, and in the fall of 2021, we joined the health program at the United Nations Climate Conference to declare that HHS and the US would pursue a resilient and low carbon health system. We developed at HHS for the first time a strategy that has in it climate change as an explicit goal, or addressing climate change as an explicit goal. And we had, through the administration, an executive order 14057, which obligates all federal facilities, including all federal health systems, to match the administration's goals for emissions reduction, roughly halving emissions in the next 10 years and getting to net zero by 2050. So there's a lot of sort of public ambition from the administration about what we seek to accomplish. And because the vast majority of healthcare provision in the country comes from the private sector, we also created an opportunity for the private sector to stand up and match that ambition. And so that came in the form of the White House HHS Health Sector Climate Pledge. This is an initiative that invites organizations to match the administration by reducing their emissions 50% by 2030 and getting to net zero by 2050, and asking them to be publicly transparent about their progress. Secondly, asks signers to designate executive level leadership for the work, and to conduct scope 3 inventory to start looking at the emissions associated with their supply chain and their value chain. And then asking organizations to in a proactive way, think about the needs of their most vulnerable populations and develop climate resilience plans with those populations in mind. So that was the challenge that we issued on Earth Day 2022, inviting organizations around the country to join us in this work. And the response has been good. If we go to the next slide, you can see that over 115 organizations have signed the pledge. These are healthcare organizations that are providers, but are also suppliers. They're pharmaceutical companies. They're a whole host of different health-related organizations that are taking this pledge and standing up and in a very public way committing themselves to this work. We can see that these organizations represent over 850 hospitals in and of themselves. If you also include the government hospitals, the federal health systems in this, that gets you over 1,000 organizations, and probably over 15% of hospitals in the country that are making commitments to this kind of work. And then in addition, as I've said, you've got suppliers, pharmaceutical companies, payers, purchasers, all also standing up and making commitments to this work. So we've been really pleased with what we've seen in that respect. We're really pleased with the level of public commitment and the willingness of organizations to really roll up their sleeves and get started on this work. With that being said, we also know that there's a need to not just make declarations and commitments, but actually to support organizations in making the meaningful changes that are required. So if we go to the next slide, you can see that there are lots of tools and supports that we've created in the aftermath of securing these commitments from lots of organizations around the country. So one very prominent support is called the Climate and Health Outlook. This is something that Jenny and colleagues have created on a monthly basis since May of 2022. It's basically a first of its kind forecast, which forecasts the climate related challenges in different parts of the country every month, looking at different hazards from extreme heat to major storms to flooding and so forth. So in addition, if we go to the next slide, there's also a new tool that came out more recently this summer the EMS heat tracker, which is a collaboration of our office and the National Highway Traffic Safety Administration, which effectively shows heat-related emergency events happening all around the country. That's what's mapped out here. These are technically EMS activations. So when is an emergency called for and related to extreme heat events. So that's a second resource that's available. And there are a number of other similar resources from HHS and from other agencies. And then there are resources that go beyond our own efforts. And so if we go to the next slide, there are great HHS-wide resources. The one on the left is called the Sustainable and Climate Resilient Healthcare Facilities Toolkit, really helping organizations self-assess themselves in the face of climate-related threats. That's actually currently being updated and will come out in an updated form in 2024. And then AHRQ came out itself with a primer on reducing healthcare emissions for hospitals, really laying out the steps that leadership needs to take to build capacity around emissions reduction, but also measure and track progress on that front as well. So all of these resources, all of these tools, if we go to the next slide, are captured in something we call the Health Sector Resource Hub. It's a very, very rich collection of resources. And I think the resource that we draw a line under most at this stage is something called the Quick Finder for Leveraging the IRA for the Health Sector. This is basically the document that distills everything in the Inflation Reduction Act that we think is relevant for health sector organizations to take advantage of. And again, this is this multi-billion-dollar historic opportunity for huge investments in clean energy, in building efficiency, in infrastructure resilience, through tax credits, through grants, through loans and other mechanisms. And that's what Jenny is going to tell you more about now. But, you know, we think that the combination of committing to the pledge and then taking advantage of these supports, particularly the opportunities created by the IRA, is something that every organization should take very seriously. And so we'll look forward to speaking with you more about that. So Jenny, over to you.
Thank you. And thanks to everyone for listening. We really appreciate it. And we look forward to your questions, like Joe said. So I'll talk a little bit about this resource that we call the Quick Finder, because, you know, the IRA is this investment of billions of dollars in clean energy and the clean energy economy. And it doesn't really mention the health sector in that context. The health sector is mostly in the Part D section around drug pricing. But there are a lot of opportunities here where there actually are big equities for the health sector, for, you know, hospitals, health centers, nursing homes, other providers to take advantage of these opportunities and to actually get money to fund these investments. And so what we went through is the bill itself and then the associated guidance, the rulemaking, the funding opportunity notices to figure out where the health sector could actually leverage these opportunities, because we know that you all are so busy actually delivering healthcare that you don't have time to go through this, you know, hundreds of pages of the bill and all of its associated guidance. So we did that and distilled it in this Quick Finder. The QR code on the screen will take you there. It's a living document that we update. And for those of you kind of considering joining the pledge, that is like a great network of our community that we speak with a lot. We send them a lot of updates, and that includes when there's a big update about the IRA or its associated guidance or program notices, things like that. We'll send that out to our pledge signees from time to time to keep them updated and make sure they're aware of all the opportunities that are coming out. This is the Quick Finder. You can also sign up for our OCHI alerts, which are linked on that page. And we also send updates there less frequently, but we'll kind of compile a bunch of stuff and send it out as an OCHI alert. So we encourage you to sign up that way as well if you want to kind of follow this and keep getting updates. So I will talk a little bit at a high level around the types of investments and actions that the IRA can facilitate. What I'll note here is there's a lot more on the website, and I won't go through the ones that are a little bit maybe too specific for this audience, like opportunities only for tribal entities or only for Native Hawaiian entities. But you might be eligible for some of those very specific opportunities that are on the website. And so I would encourage you to look there and just make sure that your organization isn't eligible for those. But so for these big buckets, One thing that I always like to note is that a lot of these programs where I've listed kind of examples of different actions and strategies that can fulfill a type of investment, and then the example IRA programs, these are all just kind of ideas, and a lot of these things actually can be used for multiple purposes. And a big example of that is that you'll see that investing in on-site renewable energy generation is itself, its own investment. It's great for your sustainability of your facility, for having reliable, consistent energy. But then that in itself is actually a resilience investment, an increase in building resilience there in the second to last row. And just to give you kind of an example of that, there are a lot actually facilities that are kind of popping up doing this work and proving it out. But I'll give one big example, which is that in Connecticut during Hurricane Sandy, a hospital called Greenwich Hospital that had a combined heat and power system was able to stay operational throughout the storm when the central grid went down. And they were able to keep providing care to their patients and actually admit new patients during this hurricane. And they also had their staff stay overnight. Around 50 staff members were able to stay at the facility and stay safe that way rather than trying to travel home. So that's one example of how when you have your generation of energy on site through clean energy, it helps you be more sustainable day to day and brings down your energy costs day to day. But then also when there is that emergency where the grid has gone down, it gives you that opportunity to be more resilient and to stay open to serve your community. So I will talk a little bit around the first and third rows here for generation of renewable energy on site and also for low emissions transportation, because these two are both facilitated by the same mechanism in the IRA, which is a really big one that we hope that you all will come to understand. And that is called elective pay / direct pay. It's referred to by both terms. But what this basically means is that for the very first time, a tax-exempt entity like a nonprofit hospital or a government entity like a municipal hospital will be able to receive the full value of tax credits in the same way they basically would if they were paying taxes and getting that tax break in the traditional sense. This is something that's brand new, and applicable entities can use these for 12 of the IRA's tax credits. Here we've listed out in this slide that we were lended by our Treasury colleagues, all of the applicable entities under the rulemaking that are eligible. And you'll see it's a really wide array of organizations and will include many health providers as well. And if you're not applicable for direct pay, that doesn't mean you can't use this. It just means that probably you're not tax exempt. So you would be using it in the traditional sense of a tax credit. But for all of these nonprofits, this is kind of a new thing of being able to receive the full value. And so we really want to emphasize that when we're talking about tax credits for the IRA, usually those are things that you can use as a nonprofit entity, which is great. And so here is a kind of a breakdown of some of the tax credits that are eligible for elective pay. I'm not going to go through all of them in the interest of time and not boring everybody on the call. But one thing that I want to note is the third line down here, the investment tax credit for energy property. So this is one that we're really excited about for the health sector. And it can pay up to 30% of an investment for solar, wind, microgrid controllers, combined heat and power, like what Greenwich Hospital had on your property. So this is huge to get that payment back. And then if you look third from the bottom, there's also what's called an adder, meaning something that's added on to an existing tax credit. And that is the low income communities bonus credit. And that can take the payment from 30% up to 50% if you're in a low income area or serving a low income community. So I want to flag these because they are just an amazing investment or amazing opportunity for these investments. And you may have seen that back in March, the Centers for Medicare and Medicaid Services put out a waiver allowing facilities to use microgrids for backup power rather than having to rely on diesel or other dirty energy backup power. So that's great. So when you're fulfilling your requirements under CMS for your emergency preparedness rule requirements, you can use a microgrid in most cases. And it's just an amazing opportunity to have that energy right on site. So what that means is you're not losing energy as it travels from a faraway grid to your facility. You're more energy efficient. And it also means that then if that central grid goes down, you're able to use the energy that you've stored on site to stay open. So it's a resilience benefit and also sustainability benefits. That's part of why I'm really emphasizing it here today. And I think this is just an incredible opportunity for all of you to consider. And one thing I should have mentioned at the top is that unlike a grant program or a loan program where you might apply and be eligible but not get it ultimately, this is very different, where if you are eligible, meaning that you are a tax exempt entity, for example, and you do the action, like you put in a solar array, you will get the payment. The payment is not limited. It's not contingent. It is, if you are eligible and you do the activity, you get the payment. The one asterisk there is that the low income communities adder, that adder from 30% to 50%, that one is something you have to apply for. So that one is a little bit more like a grant program in that sense, where it's not guaranteed. But the others that I'm showing here are guaranteed. So that's what I want to emphasize to you too, is that if you're thinking, I have limited staff capacity, I can't just spend time applying for all these grants, this is very different, where it's guaranteed funding and it's not really an application in that sense of having to like list out all things that you'll do with the money and et cetera. It's more about just saying, yes, I'm eligible, and yes, I'm putting in the solar array. So I'll leave these behind for now, but we'd welcome questions on them. And then I'll also note there are many other credits eligible for elective pay that I'm showing here on screen, and the two in the middle for vehicles, the credit for qualified and commercial clean vehicles. I always like to note that one can be used for electric ambulances. So that's another way to consider using these tax credits to make improvements in your facility and to make improvements in your sustainability practices on site. So I will quickly transition and talk a little bit about some other programs. As I mentioned, we're going to kind of go through these at a high level, and we'd welcome your questions, but also the Quick Finder has a lot of detail, like what I'm going over today. And then we actually did webinars with our colleagues from Treasury, EPA, USDA, and other agencies to go through these in much more depth. So if I'm sharing something and it's just too fast, that webinar will be an hour and may give you a lot more detail on the program. So one thing I wanted to make sure you all are aware of is the Greenhouse Gas Reduction Fund, which is commonly referred to as the EPA's Green Bank in the press. You may have heard it referred to that way. And this is the largest non-tax investment in the IRA. It's $27 billion. So a huge pot of money. And that's going to be used for these three categories shown on screen to reduce emissions of greenhouse gases and other pollutants, to deliver benefits to American communities, and to mobilize financing and private capital to stimulate additional deployment. And those three activities happen through these three arms of the program. I won't talk about Solar for All very much, the one on the far right, because that's more for residential communities. But the first two, the National Clean Investment Fund and the Clean Communities Investment Accelerator, are very applicable to decarbonizing healthcare. They can be used for a very, very wide array of activities to decarbonize your healthcare facility. And basically what's going to happen is EPA right now has funding opportunities open for the primary grantees, which are nonprofit entities that will provide financing, like say a CDFI or a bank. And they will then provide the funding to the subrecipients. And so right now, the thing to do is to wait, because those entities, those intermediary entities, have not been awarded yet. The deadline is in October, as you can see on the screen. And once they've been awarded, they will open the funding opportunities to you. But one thing that you can do now is you can use Energy Star Portfolio Manager or another tool to baseline your energy use on site to get a sense of where you are, because that will probably help your application. So just kind of to watch the space, to do your baseline. And by the way, we do have guidance on our website about how to use Portfolio Manager for a health sector entity that I hope is useful to you. We also welcome your questions, but this is to be aware of because it is such a huge pot of money and it's going to go out very soon. Another program that I will mention for this audience is the Rural Energy for America program, or REAP. And kind of like the GGRF, it can be used for just an incredibly wide array of activities, from decarbonization to energy efficiency investments. And it is for-profit small businesses in a rural area. But rural here is defined as a community of less than 50,000. So it's really a lot of towns that can be applicable here. And it can just offer amazing loans and grants for these kinds of investments. And I show some here on the screen. We actually have seen entities in the health sector utilize REAP already, which is great. We've seen them use it for new chiller systems and for solar arrays with backup battery energy storage. So some really great investments have already been made with REAP, and we hope that you'll do more. And if you want to learn about those examples I'm mentioning, those are in the Quick Finder as well. But I'll keep going in the interest of time. So now I'm kind of transitioning from those primarily sustainability focused programs I was talking about earlier to the more resilience focused programs at the bottom half of this chart. So one I will talk about that is a little bit unique is the Staff React Authority for low carbon and net zero energy projects. And what's unique here is that it's not an allocation of funding. You know, FEMA, which runs the Staff React programs, which I will show you here. These are the eligible FEMA programs for this funding. They provide funding out to communities for these resilience programs, but they didn't get more funding from the IRA to do low energy, low emissions construction work, as I was mentioning. What happened is they got the authority to do that through 2026. So in other words, they got more authority to do different things with their current funding, not more funding. So a little bit unique there, but they do have this memorandum out on implementation, which is really helpful. And it provides information on the authority for low carbon materials that can be applied to these programs. So what this would mean for you in practice is that if you are either getting a grant to prepare for disasters, or you're in recovery and you're rebuilding and getting a grant for that, you could use these low carbon materials in that construction work. And FEMA can tell you a lot more about that. This guidance is very helpful. But we kind of wanted to flag this one as well because it is a primarily resilience focused program that now for a time limited period of time has this authority to do sustainability work as well. And finally, the very last category that I will mention for you is the Environmental and Climate Justice Program Community Change Grants. There are a lot. The biggest category in the Quick Finder is the resilience category because there are a lot of programs here that are very specific to certain communities. Like I mentioned, there are a lot for American Indians and Native Hawaiians. And so I don't go through those just because they are so specific, but I encourage you to read more about those. This one is quite broad, and that's why I'm focusing on it for this audience. So basically, the funding opportunity, or the NOFO, is coming very soon. So I would watch that and watch our emails to see when it comes out. But what EPA is going to be doing through this program, and by the way, the Environmental and Climate Justice Program has many arms to it. I'm highlighting the one here that is most relevant to your work in the health sector, but there are other ones. So you may see other opportunities out already under this program. So I mentioned that so you're not confused when you see it in the press or something. But this one, the one that I'm mentioning for you, is coming out soon. And EPA will be awarding this for a wide array of projects addressing pollution, climate change, and other priority issues. They give examples in their guidance of things like addressing urban heat islands, increasing building resilience. And so it's a really broad program that will be offering funding for community change to make communities more resilient to climate hazards. And eligibility is still being defined, but it looks like right now what it's limited to is just nonprofits. And so as you can see here, most of you will qualify for this if you are a nonprofit. It's a very broad definition they're using from the regulation I have on the screen. And so again, something to consider because it has such wide applicability to many different types of investments. The last thing I'll mention is circling back to kind of how you can learn more. We have a webinar series that we put on with our colleagues from all of these programs like EPA, FEMA, USDA, Treasury, and others, where we talk about these opportunities in a lot more depth. So I would encourage you to watch those and learn more, hopefully, from watching them present on their own programs. But I hope I've given you some food for thought and a helpful overview here. And like I said, we will be updating our OCHI alerts with new updates on these, and I'll show you where to sign up for those at the end when we kind of are wrapping up. And if you are a pledge signee or become a pledge signee, we also will send updates to that group as well. So with that, I will kind of turn things back over to Joe to wrap us up.
Thanks, Jenny. Yeah, I mean, I think I'll just finish where I started by saying we're really interested in hearing your inputs and your ideas. We think that the pledge represents a terrific opportunity for organizations to not only make a public commitment, but kind of galvanize action internally within their organization and within their community. And we think that the IRA, plus all of the other resources I mentioned in the Health Sector Resource Hub, represent real wind in the sails of organizations that are standing up to do this work. So I think whereas when we launched the pledge, we were concerned about having enough to offer organizations to be able to make transformative investments in clean energy and other forms of sustainability, I think with the IRA, the opportunities are significant. And so we're excited about that. Our ask is just simply that if you have case examples that you know of that you think we should hear about of success on sustainability or resilience, we'd like to hear about that. We also, want to understand challenges in as detailed a way as we can, whether those challenges are associated with accessing funds or just understanding how to properly scope a project. All of that is useful input for us in terms of outlining the actions that we're going to take going forward to be most supportive to you. So we really thank you for the opportunity to be here and for the time, and look forward to your questions and some discussion.
Thank you so much.
Sorry, go ahead.
Oh, no, go ahead, Jenny.
I was just gonna say, this is the QR code I mentioned to sign up for OCHI alerts, and our email is also on the screen. Back to you all. Thank you.
Yeah, no, that was such a fantastic talk and a tremendous amount of information that answered a lot of the questions that I had coming into this talk. So I really appreciate all the opportunities that the Office of Climate Change and Health Equity is providing to organizations to decarbonize and help us move towards net zero goals. I had a question that I was going to start with from myself. With today's announcement from the Joint Commission of a sustainable healthcare certification program, is OCHI working with the Joint Commission, which I know has taken the HHS decarbonization pledge, to ensure that these programs support each other or are in alignment? Did OCHI work with the Joint Commission on some of the criteria that they're going to use in this certification program?
Yeah, we had representation on the technical advisory panel that the Joint Commission brought together to try to think about the best actions that they could take. And there was earlier a proposal for a sustainability standard, which the Joint Commission, based on feedback they had from the health sector, ultimately decided not to introduce. But this certification is still a way that organizations can be recognized for taking proactive steps to address climate-related challenges and to become more sustainable. And so it's something, yeah, we're in regular contact with them, in part through the National Academy of Medicine's Climate Collaborative, which brings together government stakeholders, private sector stakeholders, major associations, accreditors, regulators, state officials, members of the public, to have regular discussions around what should our shared aims be and what contributions can we make from a policy standpoint and from a programmatic standpoint to make that happen. So in fact, we were a part of a conversation with them on Monday in that group.
Do you envision this certification becoming a standard or a regulation in the future? I know there was resistance or some feedback against that in their initial ask this spring, but I'm just curious to see. It kind of still feels like it's something that is lingering out there as a possibility.
I can't speak for the Joint Commission, and it wouldn't be right for me to do that. I know that their leadership is taking this issue very, very seriously. I know this is one of John Perlin, their CEO's top priorities for the organization, to think about sustainability and to think about the impacts of climate change on the health sector. So there's a real level of seriousness there. They did decide to back off of having a standard based on feedback that they had last winter, but I do think that again, it's for them to say, but it seems like that based on what happens with their certification program, I suppose anything is possible in the future. But again, it's really for them to answer that.
Sure. Question from Adrian Gallo in the audience: are there templates for these grant applications or any successful applications you could share? Just having a grant outline for some of these programs would be immensely helpful.
Yeah, I really appreciate that question and the need to kind of have things that are more plug and play for these applications. It differs program by program. Adrian didn't mention a specific program, is that right?
I do not see one specifically, no.
Yeah, so I think what I would say is when we have examples of groups that have used these programs before successfully, we include that on our website. So you can find examples of real groups that have used these before there. In terms of a template, I know some programs offer a lot more in that way than others. And I'll also know that some programs are much more free flowing with the templates they will accept. Like I know the Environmental Justice Grant Program will accept a really wide array of templates and are trying to make it very accessible to groups that may never have applied for a federal grant before. And so I think there's a lot of thought going on in different programs around how these can be a lower burden on you all to apply for. But that's also why I emphasize the tax credits, because it's much less burdensome to become eligible under the tax credits. It basically just involves you all, showing that you are a nonprofit and then showing that you actually are doing the action. So that's why I emphasize those, in part because I know the grant applications can be very time consuming.
One follow-up to that, at CleanMed this year, speakers from a consulting firm kind of laid out some of the IRA opportunities, a little bit similar to some of the talk you guys just gave, really focusing on the energy generation, tax credit, rebate, direct payment opportunities. Are there specific vendors we're required to work with to make this happen? Because it seems like a lot of that goes through the vendor doing some processing and submission of paperwork to ensure that certain standards are met? Or is it something we can just do the work and then get reimbursement? And another part of that is, we have one large power provider, Idaho Power, that really wants to control the grid and run most of these projects. Is it possible to partner with a local utility like Idaho Power to have them build and manage it, but still have access to the tax incentives?
That's a really good question. And it kind of gets at like two of the ways the IRA tries to make these more accessible. So one is transferability, the ability of you to transfer your tax credit to somebody else, basically, which it sounds like is kind of what this group was presenting on. And the requirement is to do the actions. There's not a vendor you have to work with or something like that. And then the other one is the direct payment piece, where you can accept the direct payment. You could also use that in theory as collateral for a loan, say, or for an investment, to be able to pay someone back later for the investment you're making and owning your own system. And you get at an important kind of distinction between owning your own system versus somebody else owning it and you reaping the benefits of the clean energy, which is another approach you could take. So there are a lot of ways. And I guess what I'll say is we're hearing a lot from the sector about the need for bridge financing and TA to take advantage of these opportunities, both because it's complicated for the first time to consider putting in, say, your own microgrid or your own solar array. And then it's also like you just might need financing to get it off the ground to be able to reap the benefits of the tax credit later. So we're hearing that, and we're thinking a lot about how we can be helpful there, because I think it is a real need just across the sector.
But just to be crystal clear, there's no obligation to work with any vendor in accessing those tax credits.
Great. Question from Hongmei Castillo in the audience. One of the social determinants of health impacting a large portion of our patient populations across the health system is a lack of a tree canopy, which exacerbates heat stress in our warming climate. Are there examples nationally where the office has seen health systems partnering with community organizations to address those areas that are outside the scope of traditional healthcare delivery, but very much affect our patient outcomes?
I can't think of examples with the tree canopies specifically. I can certainly tell you that there are hospitals and health systems, as I'm sure you're aware, nonprofit systems, as part of maintaining their status, have to demonstrate community benefit, have to demonstrate investments in the community. And there are certainly communities that have, as a part of that work, identified climate-related vulnerabilities and worked with the community to identify climate-related strategies, maybe related to transportation, maybe related to increasing green space, maybe related to introducing more resilient infrastructure. I think there are areas that are thinking in that way, and health systems are a part of that conversation. There are certainly healthcare organizations that have made major investments in sustainability, in green roofs, in community gardens. There are a number of examples of that. I just want to make sure I'm answering the question that's being asked.
I think so. And I would be excited to share that we have a local example here at St. Luke's of how our healthcare organization is doing something like this. We have partnered with the Treasure Valley Canopy Network, which is a local nonprofit that's working with the city of Boise on their City of Trees initiative. We just completed an index of our tree canopy on the Boise campus of the St. Luke's Hospital System. And we're looking at using that as part of an application to become part of the Arbor Day Foundation's healthcare tree canopy program. So Arbor Day runs a program to encourage healthcare organizations to consider the tree canopy on their campus as part of the healthcare they provide. Studies have shown that patients who are in hospital rooms that have access to green spaces have shorter hospital stays and less complications than those who are surrounded by concrete. So we're excited to make more green space available to our patients and our staff who are at work, and think that this Arbor Day program is really important in doing that. Yeah, and obviously helps with cleaning the air around our healthcare spaces, helps with reducing heat. And Treasure Valley Canopy Network has done some work to show that areas in Boise that have poor tree coverage have significantly increased heat. Other organizations have shown that correlates directly to admissions. So some of this work is being done out there. I just don't know that it's been necessarily housed under the same program that we're thinking of now, but I think we should be thinking of it that way.
Very interesting. Yeah, I mean, if that gets written up at some point, we'd be glad to read more about it.
Yeah, and I'll just share for the environmental justice grants I mentioned, that's one of the examples they give in their initial guidance of how to use the funding for addressing urban heat island effects and tree planting. So I think that would be something that if you're considering that kind of investment, but looking for funding, one potential venue would be to watch the NOFO that comes out for that in the coming weeks to months, and maybe apply for it.
Jenny, there's just such an overwhelming amount of information and funding opportunities that you've presented today. Is it possible for organizations to reach out to you or someone in the office to kind of go over some of these ideas and see what really would work for us best, kind of kick some ideas that we're considering off of someone in the Office of Climate Change and Health Equity to help guide where we're going?
Yeah, we're happy to do that. We can't offer, personalized technical assistance or tax guidance, just like as a public entity, but we are happy to talk about like these ideas and the ways they could be used, and what you're thinking about. So we would welcome your questions at the email on the screen, and we'd be happy to talk more about it.
So a question I have, does OCHI work with the VA in their efforts to decarbonize, or is the VA's work in their decarbonization totally separate from OCHI? And if they are working with the VA, is there a way that the programs they develop, the stuff that they're designing to help the VA reach these goals is made publicly available for other organizations to use?
Yeah, so we work very closely with the VA. In fact, we were just on a call with them yesterday. They're a part of something that we created called the Federal Health Systems Learning Network, which is all of the federal health systems coming together on a regular basis to trade notes with one another about how to best achieve the goals outlined in Executive Order 14057. That's the executive order I mentioned to you that requires all federal facilities to ultimately achieve net zero. And the federal health systems are hard at work on this, and they're looking at both the kind of facility-based and fleet-based emissions reduction strategies, but then also clinical decarbonization strategies. beginning to explore things like anesthetic gas reductions or reductions of gases with high global warming potential, and reducing physical waste and so forth. So there's a lot of work happening with all of the federal health systems there. We've tried to be pretty transparent about it. We had a webinar session a little under a year ago now, which kind of described what the federal health systems are doing and tried to share some of their notes and best practices. But our goal is that, roughly every year we give an update and as much as possible share what the federal health systems are doing to try to offer solutions or ideas, but maybe also inspire some action in the private sector as well. And I do know that the VA intends to be even more transparent about the approaches it's taking. All of these federal groups have been well represented at CleanMed in past years and will be again, I'm sure, in the coming year. So they're really sort of seeking venues to talk about the approaches that they're taking.
I have a question for you about e-ambulances, which Jenny mentioned. That is an item I'm really interested and passionate about, but have, despite a lot of looking, not found any availability or access to a company that is selling these. The way EMS is run varies from city to city, county to county, healthcare system to healthcare systems. There's no one stream of purchasers for ambulances. And I don't believe St. Luke's owns any of the ambulances, but we help several of the EMS communities that serve us purchase ambulances. I think the health benefits of an e-ambulance parallel those of school buses, which I don't know if it's an OCHI program, but the clean air campaign around school buses has been very well supported by the federal government. And I'd love to see something similar with e-ambulances so that, when these big diesel ambulances are sitting in our emergency bays, chugging away all these diesel exhaust fumes while the patients are coming out with an oxygen mask on right through this big cloud of diesel exhaust. We could instead have a clean, quiet ambulance sitting there. And it seems like, an ideal use for an electric vehicle.
Yeah, thank you for sharing that. I completely agree. And we were very excited to see Treasury clarify that ambulances do count for the Commercial Clean Vehicles program. So that'll be it varies by weight, but it can be thousands of dollars you get back for a clean vehicle. And then I'll just note, for facilities that might not run ambulances, but might have say buses that go to your community or other systems that you run, a lot of those vehicles are also eligible. So there may be other eligibilities. There's also a tax credit that you can use with direct payment for a refueling station on your property to refuel clean vehicles. So there are other opportunities there, but I really appreciate that. And as we have more information on potential success stories of the clean ambulances, we'll definitely share those.
All right, I got one more question for you. Do you have any examples of a healthcare system that is using a microgrid for backup power? I really would like to see, someone who has done this successfully. I feel like that example of this kind of dual nature, hitting resiliency so that if the grid goes down, you've got access to power and can keep funding healthcare services. But also a way to kind of transition away from diesel, which we're using as backup power now, to something that's clean. The grid itself is covered. Are the batteries that would store the energy covered on that energy generation payback as well?
The tax credit, I believe so, but let me check on that for you. And so for examples, we do have a lot, which is great. So we have in the Quick Finder, we talk about the Kaiser Richmond facility, which does have a microgrid with backup power that's fueled by solar arrays and can keep the facility online if the grid goes down. And then if you just look up Valley Children's Healthcare, that's a great facility that is putting in the largest pediatric microgrid in the country for a healthcare facility. And I think it will be supplying around 80% of their energy needs and will also be able to keep them online if the grid goes down. And that one, again, is fueled by solar panels.
I mean, I will say, just the benefit of the audience, just so everyone's aware of it, I think we might have mentioned this in passing, but CMS last spring did issue a waiver, which clarified that healthcare organizations can develop their own microgrids. They don't need to use diesel for backup. They can use microgrids for backup power generation. So solar, wind, fuel cells. All of those options exist, and so that's something that was validated for all provider types, except I think maybe nursing homes, by CMS in March.
We are a healthcare organization that serves a pretty varied population. So we have hospitals in more affluent communities, hospitals in more rural, less affluent communities. For the 50% kick up you can get, does that count if you have like a footprint in a less affluent community that has more needs, or is it your whole healthcare system's overall reach that determines whether you can have that access to that extra 20%?
Yeah, it's a good question. So I don't want to, the specific wording is in the rule that's linked to in the quick finder, so you can find it there. But basically it's if your facility is either in that community or primarily serving that community, and that's defined in more detail. So I don't want to like speak off the cuff about those numbers, but it's basically where you're located or who you're serving that matters.
Great. One thing that we have seen in our own efforts and in efforts with other sustainable partners throughout the healthcare system is the critical importance of healthcare leadership, healthcare executives buying in and being a driver for this change to happen in healthcare. Is OCHI doing anything to reach out to that specific population to really kind of help them see the financial benefits of becoming more sustainable and driving this decarbonization?
Yeah, I mean, as I mentioned, so we're part of the National Academy of Medicine Climate Collaborative, and that includes groups like the American Hospital Association, and includes, some of the major thought leaders, not just in climate health, but in healthcare in the country. And I think that's one of the venues in which we're trying to develop a set of cases and examples which clearly describe the importance of sustainability from a moral, operational, financial standpoint. We've also been out to major leadership groups, trying to engage with boards, because we think that boards of directors can be really influential here. And my experience prior to working in climate health was working in patient safety, and in patient safety, 20 years ago, it would have been rare for boards to be looking at quality and safety events at a board meeting, and now it's pretty much the standard in any health system. That started with a few boards that modeled that and then taught other boards about it. So I think we kind of need to get boards on board, so to speak, and have them model that for one another. But to come back to the IRA, I think that the IRA is a very helpful reason to have that conversation. It's not just to say to folks, if you make a major capital investment, you will realize some increased sustainability and savings down the line. It's making those major investments is a lot easier through these tax credits and through other sources of funding. And so now's the time. I think leaders tend to pay attention when there's an opportunity that could help them meet their mission and impact their bottom line, and it's one that's not going to last forever. And so I think helping leaders to understand the opportunity and seize on it is a big part of our job right now.
So there's not a cap on the funding that's available through IRA. Is there a time deadline for receiving funding through the IRA?
Yes.
Depends on the program. Go ahead, Jenny.
Yeah, that's what I was, program by program. Yes. So I'll just give an example of one that's coming up soon for the Rural Energy for America program, that one that is for, a business in a community of less than 50,000. The first $1 billion will be distributed in the next year, so before September 2024. And then the next billion or so are distributed until about 2031. So a lot of the funding is coming in the next year. So that is one where I think it makes a lot of sense to prioritize and think about how to apply very soon. Other programs have other limits on them. Some tax credits expire or phase out fairly soon, but it kind of varies program to program.
Great. Well, it's 1 o'clock now. I want to respect everyone's time and thank so much Joe McCannon and Jenny Keroack from the Office of Climate Change and Health Equity for coming and sharing all this incredible information about the resources that are available to us. Thank you for your time. I love the QR codes, make it so easy for us to participate, but still be able to get all that good information. We are taking October off from our climate and health lecture series, but we'll be back on November 1st with Dr. Howard Frumkin talking about climate change and human health and how to maintain hope. So thank you everyone for your attendance today. A recording of this talk will be on our website in about a week. Feel free to share once you've got it. Thank you, everyone.